Hello, and thank you for attending this open house session for the Bachelor of Nursing program at Mount Royal University. I would first like to acknowledge that Mount Royal University is located in Calgary, Alberta, the traditional territories of the Niitsitapi Blackfoot and the people of the Treaty 7 region in southern Alberta, which includes the Siksika, the Piikani, the Kainai, the Tsuut'ina, and the Stoney Nakoda. We are situated on land where the Bow River meets the Elbow River. The traditional Blackfoot name of this place is Mohkinstsis, which we now call the city of Calgary, also home to the Métis Nation. We will be talking you through this PowerPoint presentation and to further introduce you to our program. So let's start with our first agenda item, which is the introductions. I am Patty Prima, an associate professor with the School of Nursing and Midwifery here at Mount Royal University, and I will be speaking first. I would also like to introduce Joanne Boma, a colleague and associate professor here who will join us later in the presentation. The Bachelor of Nursing program is a 4-year full-time program, and you will graduate with a university degree. This program is made up of 35 courses, which include lectures, labs, and clinicals. We call our clinical courses practicums, and our program encompasses 10 practicum courses. We also offer 4 general education courses to round out our program. We start you off right away with nursing courses in your first year of this program through to the 4th year. This includes labs, which we offer in our Health Simulation Learning Center. And I encourage you to watch the video they have created for this open house as well. You will also find yourself engaging in clinical practice right from the first year, which we are offered in hospital as well as community settings. Our BN curriculum allows you to see an immediate impact as the practice assignments take students out into the community where, along with your classmates, you assess needs and see how nursing can support and promote health while you're learning to make a difference. Our curriculum also focuses on health, not only illness, which allows students to explore issues and ethics promoting health and wellness community-wide. Your BN experience at Mount Royal offers knowledge and practical skills, including in-depth theoretical knowledge, extensive practice experience in a variety of health and care settings, a keen understanding of nursing issues and ethics, the ability to collaborate effectively in a team environment, a well-rounded education. You will garner a degree from an accredited, recognized, very well-respected nursing program, and the necessary preparation to successfully complete the National Nursing Registration Exam, which all potential nurses must write to be able to practice as a nurse in Canada. In addition to the nursing courses and practice, the BN program includes the general education component that helps prepare students for their future by ensuring they have a well-rounded knowledge base. These include 4 key areas of study: numeracy and scientific literacy, communication, community and society, and values, beliefs, and identity. As a registered nurse, you have an opportunity to work in many areas of nursing, such as surgery, pediatrics, mental health, or geriatrics, just to name a few. Nurses also maintain health records and at times supervise other nurses and support staff. Nurses can care for clients in the hospital or at their homes, with changing duties according to the needs of each client. Nursing skills are needed in the community by visiting schools, nursing homes, community centers, or private residences. By engaging with the public, registered nurses have an impact on health trends and target populations at risk. Nursing is never boring. With the variety it offers, it's an engaging career to be involved in. We will now hear from Joanne Bauma for the remainder of the presentation.
The courses in the program are reflective of the education that students require to prepare them to graduate and start their career as a novice nurse. Throughout the first year, there are a range of courses that include foundational content like biology and normal physiology, statistics, communication, psychology, and research, all of which informs our nursing practice. And there are additional courses that focus on health promotion, nutrition, and the theory of nursing. Second-year courses build off of first-year knowledge and start to explore alterations in health. What happens when the normal becomes abnormal? Concepts like ethical practice are integrated throughout the year. And as Patty mentioned, the general education courses are additional courses from a wide range of topics to add to the educational experience. In third year, there are 5 blocks of courses and students are only in 1 block at a time. The content across the year encompasses courses from preconception and childbirth in family newborn through the lifespan to seniors' health. Students have exposure to all the client populations, both in theory courses and through clinical placement. So in addition to family newborn, we also involve the child health, adult health, and mental health. Fourth year starts the transition to becoming a graduate novice registered nurse. Leadership is integrated both in theory and clinical practice, and the final focus involves a preceptorship in clinical practice where the student works side by side with a nurse, working the hours that they work and being able to manage the workload of multiple patients by the end of the course. And this is the transition to independent practice. Throughout the program, the clinical experiences are in a variety of settings, ranging from hospitals to communities, schools, and beyond. The 5 blocks in third year combine that theoretical and clinical experience to pull the learning through in all populations. There are a lot of awards that are available to MRU students, and we recommend that if you need a scholarship, please access the website listed and follow the guidelines to position yourself to be successful. What sets us apart? What makes the Mount Royal University School of Nursing program special? Our graduates are prepared to enter nursing as a novice registered nurse, ready to work to a full scope of practice. Our program is grounded in the determinants of health with a focus on keeping populations healthy. Our faculty has a lot of past and current clinical experience. We are very intentional about teaching across the lifespan. And Mount Royal University is a university that has a student-centered and teaching-focused environment. The admission requirements for the Bachelor of Nursing is a competitive one, and certain criteria for courses must be met. Please contact the Admissions and Recruitment Office for more information. If your questions have been answered and you are ready to apply, please do so via the website posted here. Thank you for spending some time learning about our Bachelor of Nursing program at Mount Royal University, and we wish you every success in your pursuit of your education.